Now, glass ionomer cement is one of the cements with I would say, the longest history of successful use. And basically, they are a generic term which is denoted by polyalkenoate cement. Polyalkenoate cement. Polyalkenoate cement. The glass ionomer cement was initially introduced in the year 1972. It was by Wilson and Kent in the year 1972 by Wilson and Kent. And initially, the glass ionomer cement was called by the name ESPA, that is aluminosilicate polyacrylate. ESPA stands for aluminosilicate polyacrylate. This glass ionomer cement is also known by certain other names like man-made dentine, it's also called man-made dentine. Man-made dentine because the properties, especially its resilience and its capability to bond with the dentine, is similar to the natural dentine, and its coefficient of thermal expansion, that is alpha, is nearly equal to that of tooth structure. That's why it is called man-made dentine. Its alpha is nearly similar to that of tooth structure. Now, this glass ionomer cement basically available as a powder liquid system. It is available as a powder and liquid system. The powder is nothing but, as the name indicates, glass ionomer. It is calcium fluoro alumino silicate glass. Calcium fluoro alumino silicate glass. Okay. Which is consisting of powder particles in the range of 15 to 50 microns. Okay. Powder particles in the range of, further. In the range of 15 to 50 microns. 15 to 50 microns. 15 microns particles, they are used for the luting purpose, and 50 microns, they are used for restorative needs. Okay. And if we talk about the liquid is basically an aqueous solution of polyacrylic acid. PAA stands for polyacrylic acid. It is an aqueous solution of polyacrylic acid. Aqueous solution means it is water-based. Sorry, there is. Good evening, everyone. Sorry for the technical snack. That happened today. I'm starting with dental cements part. Dental cements part 2. In the last session, we have discussed about zinc phosphate and zinc polycarboxylate. Today, I would be talking about glass ionomer and its variations. The glass ionomer cement is one of the cement with the oldest history of successful use. It is still used clinically in majority of the situations. It is a very good Restorative material, which has the unique property of adhesiveness, means it is capable of bonding to both enamel and dentin, and that property makes it a cement suitable in majority of the clinical situations. So glass ionomer cement was initially introduced in the year 1972 by Wilson and Kent. And the initial composition of cement was called ESPA, that is aluminosilicate polyacrylate. The first cement to be developed by Wilson and Kent was designated as ESPA-1, aluminosilicate polyacrylate, because it is a combination of various calcium, aluminium, and silica salts. Then came ESPA-2. ESPA-2 was developed by Wilson and Crisp in the same year, that is 1972, by Wilson and Crisp. This ESPA-2 was different from ESPA-1 in the sense that dextrotartaric acid was added to it. Dextrotartaric acid was added to it. This tartaric acid decreased the viscosity of the cement and increased the translucency of the cement. Increased translucency means the cement was more aesthetic as compared to ESPA-1. Then, to further enhance the properties, there was further development in the cement composition, and it was designated as ESPA-3. ESPA-3 means methanol was added to it. Methanol was added to the liquid. This methanol also increased the manipulative properties. And finally, in the sequence of development was ESPA-4, aluminosilicate polyacrylate cement 4. These are the initial forms of glass ionomer cement developed since 1972. ESPA-4 was containing copolymers of carboxylic acids. There were copolymers of carboxylic acids like itaconic acid and maleic acid. So, apart from the principal component that was polyacrylic acid, some copolymers of carboxylic acids were present that further enhanced the properties like working time, setting time, etc. of the cement. These were the initial cement designated as ESPA, the first forms of glass ionomer cements. The contemporary glass ionomer cement is basically a powder and liquid system. The powder, as the name indicates, is the glass powder. What is glass powder? It is a mixture of calcium, fluoro, alumino, silicate glass. Calcium, fluoro, alumino, silicate glass means various oxides of calcium, calcium fluoride, aluminium oxide, silica, etc. And these powder particles are in the range of 15 to 50 microns. The powder particle size is in this range. These components, they are sintered at temperatures of 1100 degrees Celsius to 1500 degrees Celsius, and they are then ground to give the powder particle in the size of 15 to 50 microns. The liquid is nothing but it is an aqueous solution of polyacrylic acid. It is an aqueous solution of polyacrylic acid. Polyacrylic acid, aqueous solution means basically it consists of 40 to 50% polyacrylic acid and remaining is water, means glass ionomer cement is a water-based cement. And there are copolymers of other carboxylic acids like itaconic acid, itaconic acid and maleic acid. These other tricarboxylic acids are present, and a special component is tartaric acid. Tartaric acid has got significant influence on the properties of glass ionomer cement. This tartaric acid, it increases the working time of the cement. It increases the shelf life of the cement, liquid, okay, especially. It also increases the manipulative properties. Means it is easy to manipulate the cement that is consisting of tartaric acid. The tartaric acid, on the other hand, decreases the setting time, which is beneficial. That is, the cement would set early in the oral cavity, and it also decreases the viscosity of the liquid. So certain properties are increased and certain properties are decreased by tartaric acid, which is a special additive to the liquid. This is a principal composition of contemporary glass ionomer cement. There are certain water settable GICs are available, which is also called anhydrous GIC. Okay. Apart from the conventional ones, there are water settable GICs. Means the powder basically consists of glass particles, as we have seen above, and there would be freeze dried polyacrylic acid. Means the acid is freeze dried and added to the powder itself. Okay. And the liquid consists of simple water plus tartaric acid. They are known as water soluble or anhydrous GIC. Okay. Because the liquid is simply water. The polyacrylic acid is added to the powder itself in the form of freeze dried state. Now, if we talk about the setting reaction of glass ionomer cement, when the powder is mixed with the liquid, that is polyacrylic acid, there is an acid-base reaction. Just like zinc phosphate and zinc polycarboxylate cements that we have seen, there would be an acid-base reaction. This leads to leaching of certain ions from the powder. The ions like sodium ions, fluorine ions, calcium ions, and aluminium ions. They are released from the powder particles due to attack by the liquid. These calcium ions, they cross-link with polyacrylic acid chains. The first set of reaction happens due to cross-linking of calcium ions with polyacrylic acid chains, and in the next 24 to 72 hours, means 1 to 3 days, these calcium ions, they are replaced with aluminium ions. Okay. The calcium ions that are initially cross-linking with the polyacrylic acid chains would be replaced with aluminium ions, and this forms a denser cross-linked matrix. And it is important to note that out of the 4 ions which are liberated, the sodium and fluoride ions, they do not take part in the reaction. Only the calcium and aluminium ions take part in the reaction. And the set cement, it has an amorphous structure. If you remember, the set zinc phosphate cement has a crystalline structure. Zinc polycarboxylate cement has an amorphous structure. Similarly, glass ionomer cement has an amorphous structure which consists of unreacted powder particles. 100% reaction never occurs. There are unreacted powder particles which are coated with silica gel. in a matrix of, and they are present in a matrix of hydrated calcium and aluminium polysalts. So this is the set structure of a glass ionomer cement. If we talk about the manipulation of GAC, then there are two steps involved in the manipulation. If you remember, for zinc polycarboxylate, we have discussed that glass ionomer cement has a potential of forming an ionic or chemical bond with the tooth structure. So to enhance the chemical bond with the tooth structure, we need the tooth structure to be free of the smear layer. So the first step would be conditioning of the tooth structure. Conditioning of tooth, and the second step involves cement placement. And what is the conditioning of the tooth? It remains the same that we have already discussed with zinc polycarboxylate cement, that 10 to 15% solution of polyacrylic acid, weak solution of polyacrylic acid, is applied to the tooth structure for 20 to 30 seconds. This is followed by 30 seconds water rinse. Okay. What happens because of this application? The smear layer is removed. But it does not remove the smear plugs. The smear layer is removed, but the smear plugs remain intact. So because of this removal of smear layer, the hydroxyapatite calcium ions of the enamel and dentine are freely available for bonding with the tooth structure. What is the mechanism of bonding? It is ionic bond. Similar to zinc polycarboxylate, by chelation of calcium ions with polyacrylic acid carboxyl groups. This chelation of calcium ions with polyacrylic acid carboxyl groups. This is the principal mechanism of bonding. And since we know that enamel is more mineralized as compared to dentine, the bond strength of glass ionomer cement to enamel is always greater than to dentine. So the principally mechanism of bonding remains the same as with zinc polycarboxylate. But if you remember that zinc polycarboxylate, the powder consists of zinc oxide, which makes it anesthetic opaque cement. On the other hand, the powder of glass ionomer cement is calcium fluoroaluminosilicate glass. These glass particles are translucent, which makes GIC aesthetic, so it can be used for restorative needs also. If we talk about the classification of these glass ionomer cements, then three principal types are available. Type 1, okay, it is used for luting purpose. Luting means cementation of processes on the tooth structure. The type 2A and type 2B. Type 2A is for aesthetic restorations. And type 2B is for reinforced restorations. And finally, type 3 GIC is for liner and base applications. These are the three principal types of GICs. And what is the difference in these GICs? The composition would remain the same. The difference is in the powder particle size. The smaller particle size of 15 microns is used for luting purpose, and the larger particle size of 50 microns is used for restorative and base applications. Okay, so what is the difference? Difference is in the powder particle size. Okay. If we talk about the properties, then as I've already told you, For different cements, we have to look for the comparison of properties. The properties, if we talk about the compressive strength of typical glass ionomer cement is similar to that of zinc phosphate cement. It is in the range of 80 to 100 megapascals. It is good in compressive strength. If we talk about diametral tensile strength, okay, it is greater than zinc phosphate cement. Comparison of properties is important. And if we talk about gamma, which is modulus of elasticity, gamma, that is modulus of elasticity, is nearly half of zinc phosphate cement. So what does the property of modulus of elasticity indicates? It indicates the stiffness of the material. As the modulus of elasticity of GIC is only half of zinc phosphate cement, it is flexible. Okay. This is very less stiff as compared to zinc phosphate cement. So if the question is asking you which cement is suited for restoration cementation of, okay, for cementation of a full ceramic prosthesis, a metal free prosthesis, then the first choice answer would be resin cement. You have to choose for the cement which is very high in elastic modulus, because we know that ceramics, they are brittle materials. They are strong in compression but weak in tension. So if I am cementing a full ceramic crown with a flexible cement like GIC, then with the flexion of the tooth, the GIC would also flex and it would transmit the tensile load to ceramic. Ceramic is weak in tension, so there are chances that the ceramic would fracture. It is important to understand what does property signify. So the modulus of elasticity is basically a measure of rigidity or stiffness of a cement. For a full ceramic prosthesis, for a full ceramic crown, we need a cement with very high modulus of elasticity. So if we have to compare GIC with zinc phosphate cement, then zinc phosphate is a better cement to lute a full ceramic prosthesis as compared to GIC. If we have to look for the cement with the highest modulus of elasticity, then it is a resin cement or a liquid composite cement. Okay, so you have to understand the property of modulus of elasticity. This is how the questions would be coming in your examinations. Okay. If we talk about fluoride release, we have seen that fluoride ions are present in the powder particle, which are liberated when the acid attacks the powder particles, but they do not take part in the cross-linking or reaction. These fluoride release happens whenever the local pH around the GIC falls down, and it is in the range of 0.2 to 2 ppm. The amount of fluoride released from a typical GIC is in the range of 0.2 to 2 ppm. This contributes to certain inhibition of secondary carries, or we can say anti-carriogenic property. But this inhibition of secondary carries is limited to a few months, because whatever fluoride is available in the GIC is consumed rapidly. We have to do fluoride recharging. By application of topical fluoride. What is meant by fluoride recharging? There is a glass ionomer restoration. Initially, the free fluoride ions would be available, and whenever the local pH around the GIC restoration decreases, that fluoride would be released and it would prevent occurrence of secondary carries around the glass ionomer restoration. But what? actually happens in the clinical situation that whatever fluoride is initially available is rapidly released and is consumed in a couple of months. So after that, the fluoride is no longer available and we have to recharge the GIC by application of topical fluoride like fluoride varnishes. So this is known as fluoride recharging, and this is done with application of topical fluoride like 1.23% acidylated phosphate fluoride, APF gel, which consists of 12,300 ppm of available fluoride. So when it is applied onto the glass ionomer restoration, there would be recharging of fluoride ions and it would again contribute to the Caries inhibiting property of GIC. So two important clinical properties of glass ionomer cement are its ability to bond with the tooth structure and release of fluoride. If we have to make a comparison, which is the best property of glass ionomer cement, then bonding capability. Bonding capability is the best property of GIC. Its ability to bond with the tooth structure is the best capability. Okay, because fluoride releasing capacity is limited to a particular time period only. If we talk about modifications of GIC, then the first type of modifications are the metal modified. Metal modified GIC. As the name indicates, metal modified, there are two forms of incorporation of metal particles to GIC. And these metal particles are basically silver amalgam particles. Okay, silver tin alloy particles. One is miracle mix, which is also called silver alloy admix. Okay. And another is called CERMET. CERMET. These are the two forms of metal modified GIC by adding silver alloy particles. Silver tin alloy particles are added. In silver alloy admix, similar, what is happened simply, the glass ionomer particles are mixed with silver alloy particles. They are physically mixed and then it is reacted with the liquid of glass ionomer cement. In CERMET, what happens? The GIC powder is fused with silver tin alloy particles at high temperature. By sintering. So what happens? The portion of the glass particles are coated with the silver particles due to fusion at the high temperature. So this is the technical difference between CERMET and silver alloy admix. Silver alloy admix is a simple mixture of GIC powder particles with the silver alloy particles. And when we fuse them at high temperature, it becomes CERMET. So what is the difference between the properties if we talk about fluoride release? Amount of fluoride that is released from miracle mix is highest, greater than conventional GIC. CGIC stands for non-modified conventional GIC, which in turn is greater than CERMET. The amount of fluoride release is minimum with CERMET, maximum with miracle mix. Okay. If we talk about bond strength, then bond strength of all three are comparable. There is no significant difference in the bond strength. Metal modified GIC, whether it is miracle mix or CERMET, is faster setting. So what properties? The setting time is decreased for metal modified GICs, both Miracle Mix and Cermet. It is important to understand that the setting time is decreased. So they are faster setting. If we talk about uses of these metal modified GICs, then they have got limited uses, restoration of primary molars. Primary molars means children's teeth because they are faster setting and have the capacity to bond. They are very well suited for children in which isolation is difficult. So placement of a more definite restoration like dental composites is challenging in children because of poor isolation, isn't it? So they are suitable for restoration of primary molars. And another clinical application for metal modified GICs is as a core buildup material. These are the two principal applications. But you should understand that there is no significant enhancement in the mechanical properties due to incorporation of these metals into the GIC. So although they are metal modified GIC, the only advantage that we derive from metal modified is that they are somewhat faster setting and they have the capability of bonding to the tooth structure, so suitable in these two clinical situations for restoration of primary molars and for as a core buildup material. Then another form of GIC is a resin modified GIC. Resin modified GIC. Resin modified GIC is also called hybrid GIC. An example of a commercial product which is very common is fit trimmer. Trade name, commercial products, resin modified GIC or hybrid GIC. It is sometimes abbreviated at RMGIC, resin modified GIC. So what is the composition? The composition is basically consisting of a powder and liquid system. So powder is basically the same glass powder that we have seen for conventional GIC. Plus, it consists of activator initiator system. We know that activator initiator system are present for dental composites, okay, like camphoroquinone, benzoyl peroxide, etc. CQ stands for camphoroquinone, whether it is chemically cured or it is light cured. Respectively, we use initiators like benzoyl peroxide and camphoroquinone. The liquid is same polyacrylic acid that is present with tartaric acid that is present with conventional GIC with hydroxyethyl methacrylate, which is a hydrophilic monomer, methacrylate resin. Okay. Hydroxyethyl methacrylate. It is a liquid methacrylate resin which is added to the liquid of GIC. It is a hydrophilic monomer. So if we talk about setting reaction, whenever we mix the powder with the liquid, the first reaction is the acid-base reaction. Like conventional GIC, this is the first reaction. And when we show light to this, it undergoes polymerization reaction. So two set of reactions occur during the setting of resin modified glass ionomer cement. The first one is the conventional acid-base reaction and the second is polymerization reaction. Whether it is chemically cured, if benzoyl peroxide is combined with hydroxyethyl methacrylate, it is chemical curing. If camphoroquinone is there with hydroxyethyl methacrylate, it is light cured. Light cured means we have to show some visible light like blue light to it. This is chemically cured. But in both the cases, there is polymerization of hydroxyethyl methacrylate to give rise to polymer chains. From monomer to polymer conversion occurs. This is the basic setting reaction of resin modified class ionomer. If we talk about the properties, then what about alpha? Alpha stands for coefficient of thermal expansion or contraction. Definitely, it is increased or greater than conventional non-modified GIC. We know that conventional non-modified GIC is a alpha which is similar to the tooth structure in the range of 9 to 11 ppm per degree Celsius. But the alpha of RMGIC is greater than conventional GIC due to presence of resin in it. Okay. If we talk about bond strength of RMGIC, that is resin modified glass ionomer cement, is greater than conventional non-modified GIC. If we talk about fluoride release, okay, then RMGIC almost release the similar amount of fluoride as compared to conventional GIC. If we have to make a strict comparison between them, then RMGIC is slightly lower as compared to conventional GIC. If a question is asking you about a strict comparison, then RMGIC, the amount of fluoride released is slightly lower as compared to conventional GIC. Otherwise, there is no technical difference. Disadvantage of resin incorporation is that there is polymerization shrinkage. Due to polymerization of resins, there would be polymerization shrinkage. And what would happen due to polymerization shrinkage? There would be micro leakage around the restoration. Second disadvantage is related to monomer leaching. Means the monomer which is present, you know that 100% conversion of monomer to polymer never occurs. So in a set resin modified glass ionomer cement, there would be monomer present. This monomer leaches out, and this leaching of monomer decreases the biocompatibility of cement. Another disadvantage is that there is hygroscopic expansion of hydroxyethyl methacrylate. How hygroscopic expansion occurs? See, these restorations would be done in the patient's mouth. There is saliva present in the patient's mouth. So when a resin modified glass ionomer cement consisting of hydroxyethyl methacrylate comes in contact with saliva, there would be hygroscopic expansion up to 8% by volume. This hygroscopic expansion can cause fracture of or tooth structure, thin tooth structure. Okay, these are the potential disadvantages. Comparison of properties is always important. If we talk about uses of resin modified glass ionomer, then they are used for class 5 restorations, especially in cases of non-carious cervical restorations. NCCL stands for non-carious cervical restorations. Okay, they are material of choice for unstable erosion lesions. Unstable erosion lesions means the lesions whose geometry is changing due to the various factors. Unstable erosive lesions, then RMTAC is the material of choice. Okay, they are also used in sandwich technique. Sandwich technique of restoration below composites. Okay, if this is a tooth preparation, We would apply a layer of resin modified glass ionomer cement first because of its good bonding capabilities and anti-kerogenic effect. And this would be followed by a composite restoration on the top. This is known as sandwich restoration. So RMGIC is used as a base below the composites in the case of sandwich technique. If this RMGIC is communicating with the oral cavity, it is an example of open sandwich. If we do a restoration like this, RMGIC surrounded all over by the composite, then this is an example of closed sandwich. This is open sandwich. But application of RMGIC as a base below the composite is known as sandwich technique of restoration. Another potential use of RMGIC is used as a barrier formation. Barrier formation where? Barrier formation in cases of non-vital bleaching. Walking bleach technique. We apply a barrier of RMGIC to prevent the seepage of bleaching materials from the pulp chamber toward the cervical dentinal tubules. They are also used in restoration of subgingival defects. Subgingival defects means we have to put a restoration onto the cementum area. Composites are not bonded well to the cementum. So the choice of restoration for subgingival defects would be RMGIC. These are the indications for resin modified glass ionomer cement. Then another modification is calcium aluminate GIC. Calcium aluminate GIC, which is commercially available under the trade name of Ceramir. CERAMIR, Ceramir. As the name indicates, calcium aluminate GIC. This consists of a powder, which is glass powder, like conventional GIC. It consists of freeze-dried polyacrylic acid. The acid would be freeze-dried, and it consists of aluminium oxide and calcium oxide in the ratio of 1:1. Calcium aluminate GIC. Okay. With some strontium fluoride. Liquid is nothing but 99.6% water. Okay, so it is a form of water soluble GIC. 0.4% their modifiers are present. So you can see that it is a type of anhydrous or water soluble GIC in which the liquid is only consisting of water only. So if we talk about setting reaction, what would be the setting reaction of this cement? The first reaction is hydration. The water is mixed with powder. So hydration reaction occurs. This hydration reaction dissolves the freeze-dried polyacrylic acid and it ionizes and ensues the conventional acid-base reaction. So first is wetting of powder particles with water that leads to ionization of freeze-dried polyacrylic acid and results in formation of acid-base reaction of conventional GIC. So these are the two set of reactions which happen with that. If we talk about properties, then the working time is 2 minutes. Setting time is 5 minutes. If we talk about film thickness, Then this cement has one of the lowest film thickness of 15 plus minus 4 or 5 microns. Lowest film thickness 15 plus minus 5 or 4 microns. And a very important property of calcium aluminate GIC is positive biological response. Positive biological response means it initiates heart tissue formation against itself. So it is not only a reparative material but also a regenerative material like calcium aluminate based materials, calcium silicate based materials like MTA. You know, the important property of MTA is that it stimulates reparative heart tissue formation against itself. Similar properties observed with calcium aluminate GIC. Another thing is that it has got a slight setting expansion. It would not contract, but it has a 0.4% setting expansion. And because of the setting expansion, it adapts very well to the tooth margins. So the seal of the restoration is improved. It ionically bonds and it also expands slightly. So that helps in achieving a very good marginal adaptation with calcium aluminate GIC, which is available under the trade name of Ceramir. This is conventional GIC, metal modified, resin modified, and calcium aluminate GIC, which are the contemporary modifications of glass ionomer cement. With this, I am concluding today's session. See you next month with another interesting topic related to the subject of cons and endo. Thank you very much for being attached with me tonight. Happy reading. Best wishes.